Students, in this video I'm going to talk about the ulnar bursa, radial bursa, synovial sheath and digital sheath, digital synovial and fibrous sheath. Here you can see, here we have blue structure, blue or gray structure. This is common synovial sheath. As I told you in the previous video of carpal tunnel, this blue structure, common synovial sheath, it is wrapping the four tendons of the flexor digitorum, superficialis, then flexor digitorum profundus, and here we have got flexor pollicis longus. As you can see, it is going to attach to the distal phalanx of the thumb. So these are the tendons, and they are wrapped in a common synovial sheath, and this common synovial sheath is called common flexor sheath. And as you can see, this structure, and this is flexor retinaculum, and here we have got carpal tunnel. These structures are passing through the carpal tunnel. As you can see this in this diagram, this sheath is present on the ulnar side, so it is called ulnar bursa. And here we have got synovial sheath for the flexor digitorum longus. It is present on the radial side, so it is called radial bursa. One important thing to note here, that this common flexor sheath, this all it has been removed, cut this portion of this has been removed, so you can see the underlying structures, or you can feel the presence of the carpal tunnel. These are the digital sheaths, digital synovial sheaths. Every digit has got synovial sheath and fibrous sheath. This synovial sheath, gray structure, and this whitish or structure is fibrous sheath. So as you can see that this ulnar bursa, is continuous with the synovial sheath of the little finger. Little finger synovial sheath is continuous with the ulnar bursa or common flexor sheath, whereas rest of the digits, they have got their own synovial sheath, but they are not continuing with the this common flexor sheath. Here this green gray structure or blue structure, here in between you can see the tendons are naked. So if infection of first three fingers, if there is an infection, this infection would be limited to the digits only, these digits only, because as you can see, this blue structure is independent of this common flexor sheath, whereas any rusted nail or any structure is going to pierce this small finger. Any pus, it can trickle down backwards into the common flexor sheath. So infection of this little finger can result in inflammation of the common flexor sheath, whereas these three digits, whenever they would be having synovitis, it would be limited or restricted to these digits only, because this synovial sheath is not continuous with the common flexor sheath. And here you can see